TENS. Indications of TENS. Acute pain. Musculoskeletal system. Articular, arthritis. Non-articular, strain of ligament muscles sprain. Lumbar spondylosis. Sport injuries. Ligament or muscles sprain. Shoulder contusion. Neurological. Trigeminal neuralgia. Brachialgia. Sciatica. Post-herpetic neuralgia. First stage of labor. Chronic pain. As rheumatoid arthritis, osteoarthritis. LBP. Lumbar spondylosis. Neuropathy or myofascial pain. Post-operative pain. Including dental extraction, post-laminectomy or abdominal injuries. Cardiopulmonary problems. Pulmonary function test after thoracotomy. Pain of frozen shoulder. Duration and frequency of treatment. The session of the PT is 30-60 min. About 2-4 times/day. The periods of TTT must not be less than 30 days at least. Rarely PT. Use the device 24, but it seems to be less effective. Side effect of TENS. Thalamic stimulation by TENS may lead to vertigo, nausea, shortness of breath or nystagmus. Allergy to gel of electrode. TENS transcutaneous electrical nerve stimulation. Definition is the application of pulsed low-frequency current of rectangular wave through surface electrode on the skin surface over afferent nerve endings for stimulating the sensory component of the peripheral nerves to decrease pain. Physical characters. It is a sensory stimulator, not miscontraction device. It is either monophasic or biphasic. It has different shapes, rectangular or spike. The most effective shape is still unknown. It is formed of pulses, which has 0.2 meters ms as duration, 10 meters ms stimulate. Sensory only, not motor fibers. Intensity 60 mA can be modified according to the proposed response. As intensity from 30-150 mA stimulates sensory only, not motor fibers. O frequency low 10-100 Hz conventional TENS. Mechanism of TENS, physiological effect just pain relief. According to gate control theory, pain which is transmitted by small unmyelinated fiber might be inhibited by stimulating thick myelinated fiber. Electrical stimulation may 7th release of endogenous morphine like substances, which has analgesic properties, and so that the effect of TENS might be measurable by estimated of the level of opiate-like substances as enkephalins and endorphins. C. It is suggested that it can 7 pain threshold. Psychological placebo effect. Methods of application of TENS. Transcutaneous method, stimulation of the peripheral nerves by application of the electrodes on the skin superficially. Percutaneous method, used as diagnostic to assess the possible value of an implantable nervous system stimulator. Implantation method, applied by using a cuff electrodes of various size which is placed around the affected peripheral nerve, usually proximal to the area of injury. Electrodes made of carbon-filled silicon. It require gel for application. If allergy, use another, certain called Theroy electrode. Skin-friendly electrode, or interrupt the period of stimulation with period of rest. In acute post-operative incisional pain, we use a disposable pre-sterilized electrodes. Technique of stimulation. The PT should recognize the device and the electrodes and the tingling sensation which can be felt during the application, and this sensation must be strong and tolerable at the area of stimulation. The frec of the device range from 10-150 Hz. The electrodes are placed at the region of pain. Electrodes placement. By direct application to the skin. 1. Over painful area. 2. In case of nerve root irritation which produce radiating pain, one electrode is placed over its dermatomal distribution, the other electrode is placed over the side of the affected spinal segment root level. 3. In cases of nerve root without radiating pain, one electrode ipsilateral and the other contralateral. 4. If the pain is muscular or bony origin, the electrodes are placed over the myotomal or the sclerotomal distribution. 5. In peripheral Peripheral neuropathy. The stimulation is at the site of the pain. Nerve injuries or electrodes placement. Hint. 6. In neurological injuries, the loss of sensation in the painful area, contralateral stimulation can be done. 7. In low back pain and cervical syndrome, bilateral stimulation of the painful area or the ipsilateral is effective. 8. If there is localized pain and no trigger point are involved, place one electrode on the painful area and the other over the dermatomal distribution, either on the opposite side of the corresponding level or distally according to the pain radiation. 9. During labor. Afrec. 120 Hz. Proximal electrode over T8. Distal electrode over S1. 2. Ad stage anterior abdomen.